Welcome to Westwood Lectures, and this month edition is particularly exciting around equine asthma and large animal internal medicine. We have an amazing veterinary school and amazing complex of 3 hospitals, large animals, smaller ones, and farm animals. 2 of them really last December, very, very impressive, including taking 3 teeth out of a horse. So just the first half an hour of that, it's quite an operation, and there's a lot of science behind it as well. Now, I'm not, however, going to be the one introducing Laurent today. I'm going to introduce the speaker, who actually has had many interesting interactions with Laurent around equine health. So, the fantastic provost and which family, Professor? I want to make sure. Miller family, yes. The Miller family, Professor of Statistics and Computer Science, Dr. Purdue. Thank you, boss.
We don't always do it quite this way, but in addition to knowing of Laurent's work and having a chance to see his experimental setup, and I'm sure you'll hear about it today, his research in equine asthma and his collaborations with engineers on campus to take data, analyze, and all these kind of things. I've also bumped into Laurent from time to time at the hospital because I have horses. And so in particular, I'm very thankful that for one championship horse in particular, he oversaw a nice recovery from injury. And as part of our overall family of veterinary medicine practitioners, researchers and scientists and clinicians, I couldn't think of a better person to come and speak to all of us. I will say one more thing. We were in Naples, Florida this past weekend for fundraising and donor engagement opportunities and kind of general celebration of all things Purdue, including a watch party for the basketball game. And I just so happened to be given a flag. Willie will recognize this. We are flying the flag in every way possible for Purdue Veterinary Medicine. So this can be the official formal introduction.
Yeah, very nice. Thank you very much. Thank you very much, Patrick. First of all, it's an honor, President Chiang, to be invited here, and really great to see familiar faces, and then people that got an interest, I guess, maybe in asthma or in horses. So I'd love to tell you a little bit more about what I do, and then I'll provide a little bit of background, where I'm coming from, and some of my experiences, in particular research experiences. Then we'll dive into the subject of asthma in people initially, and in horses. How do we diagnose it in horses? What causes it, and how we manage the condition? And then I'll finish up with some of the latest innovation that we are working on in the vet college. So I grew up in Normandy, in France, near the English Channel, and on a small horse farm, and grew up in a family of racehorse people. My father here was a jockey and also was training racehorses, and a breeder, and his brothers here were also horse trainers of racehorses. So naturally, I was in contact with a lot of veterinarians that intrigued me, and that's how really I decided to become a veterinarian myself. I went to vet school in Alfort in France, and then after veterinary school, I went to work at an equine practice about 30 miles north of Paris in a town called Chantilly. It's the largest thoroughbred equine center in France, and spent several years there, and then felt that I really wanted to learn more. I was intrigued by the work that was being done in American university, and then I decided to pursue a residency. I was lucky enough to match with a program at Tufts University in Boston, and completed a residency in large animal medicine there, and passed my boards of internal medicine, and then was interested in research. I did a PhD at University of Liège in Belgium in respiratory physiology. And my first faculty position was here at Purdue, and here we are, 28 years later. So my research experience has been varied. I started initially developing some model of lung emphysema to study the disease in people using a sheep model of the condition. I ended up working with biotech companies that were developing medical devices to treat emphysema in people, and those devices are actually currently used in human medicine to treat COPD and emphysema in patients. But most of my work has been around asthma in horses, and for that I had many collaborators on campus, and you'll see some of the names highlighted during my presentation, and then also some collaborators outside of Purdue. And the funding, the external funding that have helped me do this work has been, Animal Health and Hatch project from USDA funding. But most of the funding has come from foundation, Equine Foundation, particularly Grayson, Jockey Club, and others, and then also from industry. So this really what has allowed me to do a lot of the work I'll be talking about. So let's talk about asthma in people, first of all. And you may have heard it was already on CNN this morning or morning news about asthma medication being more difficult to find. So asthma is the number one cause of respiratory disease in people in the US, affects about 26 million people, causing more than 4,000 deaths every year. And it's the most costly disease to treat, about $82 billion in healthcare expenditure every year. So it's a big deal, basically. So what is asthma in people? Essentially, affected people are suffering from asthma for a very long time. It's a chronic disease. They are typically presenting because they are coughing, over sometimes months or years. They have also chest tightness. It's a bit hard to breathe, to move air in and out, and they have what we call wheezing. So when you breathe in and out, it's making kind of a whistling sound because of the air moving in the lungs. And this is due to the fact that there are inflammatory cells that migrate into the airway, causing some remodeling, thickening of the airway wall. There's also increased secretions, increased mucus secretion inside the airway wall. And then you see around these airways, you have also small bundles of muscle. And that muscle, when the airway is inflamed, tends to contract, further reducing the lumen size in these airways, so it's harder to move air in and out, and that's why people have difficulty breathing, that's why they are wheezing. On the other hand, what is good about asthma is it to some extent reversible, so that's why it varies over time. It depends really on the exposure to what triggers these asthma attacks. But then certainly with some drugs, you can really relax that smooth muscle and help people, breathe better. So that's unlike other conditions of respiratory disease in people, such as COPD or emphysema, where you continue to lose your lung function over time. So if you go to the physician's office, they'll refer you to a pulmonologist to actually do a lung function test, a pulmonary function test, to try to quantify the degree of airway obstruction. And that's really something that is done in the physician's office. And they also want to both quantify the obstruction, but also assess whether or not it's reversible, for example, by giving a bronchodilator that will relax the smooth muscle and reopen the airway. And as you repeat the maneuver, you'll document the improvement. And the typical test that is done, and that's also done in research as the gold standard, is what we call a forced expiration. You see here a diagram representing someone that will be trained to breathe in deeply, the deepest breath you can take in, and then blow out as hard as you can through that device that will measure airflow coming out until you can't exhale anymore. So that's something that you are coached to perform, and this is the data that's generated. Typically, you see here on the y-axis, here will be the exhalation. The airflow can be extremely high, especially in the early phase of that when you blow out, but then you can keep up that very high airflow, and you can see that over time, airflow decreases. And the dotted line here shows a healthy patient, and the asthmatic patient will have a reduction in that ability of generating high flow throughout the expiration. So that's that difference that is measured and that can document the airway constriction, if you will, or reduction in the ability, and also can test reversibility with a bronchodilator. So what causes asthma? There are many different factors and triggers for asthma attacks. In children, for example, it's often secondary to a viral infection, such as influenza or respiratory syncytial virus infection that might trigger it. But certainly air pollution nowadays is obviously a very hot topic. Also, if you have pets in the home, including horses, Dr. Wolf, you can be more predisposed to develop, asthma as a result of exposure to inhaled allergens. So we recognize different forms of asthma in people that we call phenotypes. And for example, in children, we recognize that these children will develop a type of inflammation that's associated with eosinophils. This is a type of inflammatory cells that will migrate into the airway, causing the sign. And those eosinophils are beautiful cells if you look at them under the microscopes. And the good thing about asthma in children is they tend to get over it once they hit puberty. A lot of children will improve and go on and live normal lives. There's another form of asthma in adult this time. They develop that later on in life, and the type of cells that invade the airway is neutrophils. So these neutrophils, can also create changes in the airway wall and the limitation. And there's another form. This is only the three most common phenotypes. We have at least 5 of them recognized currently in people. This is another adult onset form of asthma, and these people tend to have more of a neutrophilic form of asthma as well, and they tend not to respond as well to inhaled corticosteroids, which is really the mainstay of therapy for asthma in people. So if you compare to horse asthma, there's actually a lot of similarities between the phenotypes of asthma in people and in horses. And we've shown in this article that the children's form of asthma can correspond to a form of asthma in young horses. And then more adult form of asthma in people will correspond to more severe asthma in horses. So certainly a lot of similarities, and we'll talk a little bit more about that in the coming slides. So horses, obviously prevalent. We have over 7 million horses in the US. And just in Indiana, we have about 170,000 horses in the state. So certainly a lot of horses out there, a lot of them more for recreational purposes. And severe asthma affects about 14% of the adult horse population. So it's indeed very common. And these horses are really debilitated by this disease because they will cough very frequently, and then they'll have difficulty breathing. And this is illustrated, in this video where this horse is just standing in the room here and basically trying to breathe as it's facing an acute onset of asthma crisis. You can see head and neck moving with each breath. Each time the horse is breathing in, it's flaring its nostril wide open to try to get air in. And then when it's breathing out, it's really hard to squeeze the air out of the lungs, so the abdominal muscle have to contract very severely. That's what we call heaving in horses, and that's why the condition is often called heaves in layman's term. So for a long time, we've known this condition, but also recognized there's a milder form of the disease that tend to affect more athletic horses. And this is a condition that kind of flew under the radar for a long time because it clinically is not expressing as obviously as the horse that I just showed you. These horses may cough, but only 60% of affected horses actually do have a cough, and it's often very intermittent. And then it's manifested as decreased performance. The issue is because they don't show any obvious signs, often it's not recognized, and it's what we call subclinical. And so a lot of the time, these have really been undetected. But we know that, at least in race horses, and I'll show you some data, 80% of horses are affected by mild asthma, so it's extremely common. So how do we diagnose it? Well, the most sensitive test is to collect some cells and mucus from the deep lung by doing a procedure that we call bronchoalveolar lavage, or BAL. So what we do here is we essentially pass a sterile tube through the nose, advance it into the airway, wedge it deep in the horse's lungs, flush some sterile solution, and then collect back the cells and the mucus. And then we look at it under the microscope. And this is how we do it in the field. This is at the local racetrack. The horse is just sedated, and we do it standing. And they let us do that, surprisingly. In people, you have to have access to an ICU nearby if you want to do a BAL in a human. So this is one of studies where we showed that in healthy horses, the expected normal range for neutrophils would be less than 5% in the BL fluid, less than 2% mast cell, less than 1% eosinophils. So the other type of test that we can do is measure lung function, like it's done in people. Here, this is done when the horse is just standing by itself and breathing freely without sedation. And we essentially measure the breathing effort. And the way we do that is we first pass a tube through the nose, have the horse swallow the tube, advance it all the way to the middle of the chest, and the tip of the catheter will measure pressure change in the chest as the horse is breathing in and out. And then we fit the horse with a face mask that has a flow meter on it, and the horse then, we can measure the breathing of the horse while they are moving in and out air, and that allows us to quantify the amount of pressure needed to generate the airflow they need to breathe. And this is how this test is done. Here, this is in our lab. The horse, this is actually a client-owned horse that's standing in the stocks, has the tube in the nose, and then the flow meter on the mask, and we are recording on the computer the breath in and out. That's the flow signal here, and below is the pressure signal. And you can see in this table, line by line is each breath we can measure the efforts, what we call the DP max, the maximum change of pressure between peak inspiration, peak expiration when the horse is breathing. And so when horses are like that in Heaves crisis, what we can see here on this graph is that in a severe asthmatic horse, they have a tremendous increase in pressure needed to breathe and move air in and out because of those narrow airways. And we can quantify that, and that DP max is quantified in centimeter of water as an unit of pressure change. And you can see that the healthy horses, to compare as controls, they should have less than 10 centimeter of water pressure needed to move air in and out. Very easy to move air in and out. The thing is, the good thing about asthma, like in people, it's reversible. So if you move that horse away from what typically triggers asthma, and we'll talk about that, which is typically hay, when you bring horses inside the barn and feed them hay, that's really what starts the process. If you turn them out on grass pasture, within a month or so, usually a month or two, then they become completely clinically normal. They breathe normally, and by the way, if you remeasure their pressures here, it's back within normal limits, and you can differentiate them from a healthy horse. Same for horses with a mild degree of asthma. This test is not sensitive enough to detect that. So what we've worked is, try to find a better way. In people, that forced expiration is really kind of the gold standard to detect airway obstruction. Again, you train the person to breathe in deeply and blow out, as hard as they can. Well, good luck to train a horse to do that for you. So we actually, found a way to do that. And for that, I worked with a collaborator across campus, Frank Rosenthal, who at the time was a professor there in health and human sciences. And he was doing this type of test, forced expiration, in research dogs. He was studying actually emphysema. And for that procedure, he was anesthetizing the dog, putting them in a body box that we call a body plethysmograph to induce, the forced expiration. Say, well, I don't want to do that in a horse. Anesthetizing and suspended a 1,000-pound horse in a body box didn't sound attractive to me. And also, I wanted to develop a test we could use in a clinic. So I knew, on the other hand, that we could ventilate horses while standing. We had done that for surgeries. And so the thought here is that we would place a tube through the horse's airways, the nose and then the trachea, connect it to a mechanical ventilator here, and essentially breathe for the horse, actually breathe more than what the horse needs, because we give them 100% oxygen. And then once, after 10 minutes or so, if we stop ventilation, the horse doesn't breathe for a while because they don't need to. They have plenty of oxygen on board. So we have control of breathing. And then I worked with Frank, and then undergrad student, actually was a vet student at the time, but I had a bachelor's degree in aeronautical engineering. And so he built this stuff for us, which is a pressurized tank to be able to deliver the breath as if the horse would take a big inhaled breath. And then the 3 tanks here have vacuum into them, and these are the tanks that will aspirate the air from horses' lungs to create the forced expiration. So that's kind of the setup. So obviously it doesn't fit in the back of the truck. It's not something you can do in the field. You need a big lab to do that. And by the way, we are the only lab in the world that can do this test. And this is how it's done. So this is a video showing how we do the maneuver. So you can hear the ventilator here breathing for the horse. And so we do, need to have control of that breathing. Then our technician here switch over to the inflation of the chest and look at the abdomen there constricting as the vacuum is aspirating air from the horse's lungs. Within 3 seconds, it's over. We're connecting it back to the mechanical ventilator, and then we wean them off. So it's, very quick, and I've done thousands of those, and including with client-owned horses. And these are the type of data we obtain. So a similar type of graph compared to what I showed you for the forced expiration in people. So on the y-axis, again, the forced expiratory flow, and the horse is breathing out initially very high peak flow. And then compared to human, they can keep a very high flow for a long time until essentially they empty out their lungs. And in red, you can see this is the curve from a horse with severe asthma. They can't generate as high of a peak. And then you can see that very quickly they have these airway that start shutting down as they exhale, so they have a lot of flow limitation when they breathe out. Well, the graph in the middle, the brown graph here, is really that same horse after he was turned out on pasture for a couple of months. The horse was clinically asymptomatic, looking normal, breathing normally, but you can still detect a great deal of airway obstruction here compared to the healthy horse. So this test proved to be extremely sensitive, and we can detect also mild asthmatic horses with that test. So now let's talk about the causes of asthma. So there are 2 main forms of severe asthma in horses that we recognize based on the trigger. So the classic form of winter asthma has been known for a very long time. If you house horses inside the barn, feed them hay, especially poor quality hay that's very dusty, then they are more likely to trigger an episode of asthma. But also it can happen to horses outside, especially when you feed them those so-called round bales. Horses tend to dig deep in there. They bury their nose, as you can see in the photo, and they are exposed to very high level of molds that is contained normally even in good quality hay. And so this is the classic form of severe asthma. But there's another form that horses now that are on pasture develop usually in the middle of the summer between June and August. And this is more common in the southern states in the US. And these horses have exactly the same phenotype otherwise, except the trigger is pollens and molds that are floating around on pasture when these horses are in the middle of the summer. So the trigger is different, but the disease is exactly the same. Clinically, we cannot distinguish them. So research on severe asthma has been really the focus of most researchers for the past 30 years or so. A lot of studies have been done, and we understand the disease quite well. But there were little done on mild asthma, mainly because it's hard to recognize clinically, and then the tools were not very available to investigate it. So when I started researching the disease, over 20 years ago, I thought about the classic model of, disease being caused potentially by infectious agents. There were certainly evidence in children that viruses could play a role. There were evidence from studies in the UK that maybe a bacteria infection were involved. But also we thought environmental exposure would be a big factor. And then certainly there got to be some factors due to the horse, age or genetic makeup and so forth. So we investigated all these different aspects, and I'll focus more on the environmental factors in the next few slides. So what our studies are shown essentially is dust exposure is a big trigger of airway inflammation and responsible for asthma in horses. That started with studies by Dr. Ivester, who at the time was doing a PhD in my lab, and she's still working in my lab, but as a research scientist now. And her first study was to study racehorses, thoroughbred racehorses, when they first came into a training center. Essentially, the first month when they arrived at the training center, she followed those horses. She designed equipment to monitor dust exposure in what we call the breathing zone, so around their nose. And then she collected, airway sample with BALs to look at the evolution of inflammation over time. What she showed is that in these very young horses, they were 18 months old, we call them yearlings. As the exposure to respirable dust increased, there was a marked increase in inflammatory cells in the airway of these horses, and these were eosinophils. So again, similar to what we see in children with atopic asthma, we saw that in these young horses coming into training for the first time. What was unique as well is we looked at different sized dust particles. The only one that was associated with airway inflammation were small particles. Respirable means less than 4 micron in diameter. Just to give you a sense, the diameter of a human hair is about 50 to 100 micron. So 4 micron, you cannot see it with the naked eye. And we looked at larger particles, and they were not associated with airway inflammation. So then the next logical step is to, let's look at racehorses now, the more normal adult population at the racetrack locally in Indiana. This is the Shelbyville racetrack. And we did a similar study in that horse population, monitoring their dust exposure and their airway inflammation. And what Dr. Ivester showed is that in these horses, again, as respirable dust exposure increased, airway inflammation increased, but this time was not eosinophils, but neutrophils. A little bit akin in adult people, that tend to develop more of a neutrophilic airway inflammation. Another interesting fact is that a lot of other horses had a different type of airway inflammation, mainly caused by mast cells infiltration in the airway. These cells are very characteristic on BAL. And in there was not the dust that caused the increase in mast cell, but the beta-glucan content in dust. Beta-glucan is a component of fungi cell wall, a plant wall. So the idea was this was likely an allergic response to exposure to molds contained in the dust. Surprisingly, 80% of horses had increased number or percentages of inflammatory cells in the airway, so very surprising. And more importantly, the higher the inflammation in their lungs, either from neutrophils or mast cells, the lower their performance. Here on the y-axis is a measure of performance we call the equibase speed figure. Essentially, it's the speed of the horse adjusted for the distance and several other factors like track conditions and things like that. So again, the more exposure to dust these horses were being subjected to, the more inflammation there are in their lungs and the lower their performance. So how do we measure dust in these horses? So this was quite an involved process when we started those studies back in the days. It's interesting how much horses let you put on them. That's always been surprising to me. But on the halter, we put those sensors that had essentially built in a little filter part. And then you connect that to a pump that sucks air through that piece. In this case is a cyclone. And then the filter essentially captures the dust that hits. And based on the design of that piece, you select the size particles that you want to measure. And so this is showing, students, actually my PhD student at the time, Dr. Lave, equipping a racehorse. This is at the Shelbyville racetrack. And so here I have a student putting in the pump that's needed to suck the air through the filter. Then we pass the tubing through this that will be run along the neck of the horse, passing through the mane and eventually attaching it to the samplers on the noseband of the halter of the horse. And so it takes about half an hour at least to get the horse, prepped like that. And then the good thing is the horse can go about their daily life and eat and But we usually sample for about 4 to 6 hours because this is very small dust. So it takes a lot of it to be able to then detect it in and measure it as we do on a high precision scale. So we measure the filter before and after the sampling, and the difference is the amount of air divided by the volume of air that was sampled. And then you have to desiccate the filters overnight. I mean, it's a very involved process, as you can tell. So we are looking for a better way, and obviously technology has improved dramatically over time. And we came across Tom Peters at University of Iowa, who he's an engineer by training and environmental health scientist. And he had designed a dust sampler that could be carried by firefighters. So they could measure exposure to particulate, in those extreme conditions. So he had designed really rugged samplers here. We need that for our horses because they're going to destroy everything you put on their halter. So this is the device that he built for us that has a particle sensing part of it in it. And then obviously we store the data here. There's a GPS system, so we know where the horse is located. There's a temperature, humidity sensor. And all of this just fits on the outside of the halter, and they carry it. And the other thing that we did is we put a little video camera, a drone camera on the top of it to look at the horse's nose when they are eating. That way we can see in real time what the dust exposure is and see what is the horse doing at that time. Why is the dust so high or so low? And Tom named the device Black Beauty, of course, BB. And so that's what we've been using in a lot of our recent studies. So this sensor that he used here was designed, originally to really measure people exposure to various, environments. So we had no idea how that would behave in a horse environment. Exposure to organic dust like hay is very different from being on the side of a road or next to a factory. So we found a collaborator on campus, Chicken Nee in ABE, who really is specialized in measuring dust exposure, especially in animal housing, chicken coops and swine housing and things like that. And then also we collaborated with Jae-Hong Park in environmental sciences. And basically we wanted to validate the BB monitor against what is considered the gold standard when you measure dust exposure, which is called TOM, short. And so he came and brought in his equipment. This is Chicken Nee. This is in a horse stall, and we created a dust chamber where we could vary, dust generated from regular hay and see how the BB compares to the gold standard. And what we found is actually there was really a high correlation between the BB and the reference method, the TOM in this case. But you can see the slope is not 1, so it was not exactly matching. We had to apply a calibration factor. But that was fine, we can do that. And the good thing as well is when we compare 3 different BB units to each other, they're very highly correlated to each other. So that means we can now go in the field and equip multiple horses at once with different BB units and be confident about the data we record. So we went ahead and did some field testing. A lot of the studies were done, at different racetracks. And this is an example of what we collect. So the data is uploaded in this software. So here you have, a line for the particle that are less than 2.5, and then another line for the particle less than 10, and then we upload the video file. And the way we synchronize that is that we shake some hay outside the stall, put the BB monitor on it, so we generate a big peak like you see here, and then we put it on the horse and let the bee in the stall. And so this is an example where the horse is equipped with the monitor. You'll start, the video will kick in. Now the horse is looking around. We just put some grain in the bucket. So the horse is eyeing that bucket of sweet feed. And here that line is moving to the right ever so slowly. And you can see that the dust level is very low and stays very low even when the horse is eating that sweet feed because it's grain mixed with molasses. It's very sticky, not much dust generated from that. But then if we look at the horse now that's equipped with it but fed hay, so it's very dark here because basically the horse is munching on hay that's in a bucket. So you can't really see what he's doing. But you can see the red light flicking at time. But here you can see the dust level is extremely high when the horse's nose is buried in that bucket when he's eating the hay. Now the horse is moving his head away from the hay, going to the front of the stall to look at what's going on outside. And you can see that the dust measurement drops dramatically at that point. So now we have a way to measure in real time, what the source of dust exposure is and what is generating that source of exposure, which in this case you can see it's eating hay, which is the favorite food for any horse. So how do we manage horses? Knowing some of this. So this is some of the work done by my former PhD student, Dr. Lave. Here we are using our teaching herd at the vet school to try to understand, what is the effect of dust exposure on horses' airways. So our horses, usually over the winter, they are kept outdoors and they are fed in these big round bales of hay. And so she essentially monitored those horses for a couple of months, measured dust exposure as they were eating the hay, and then collected cells from the lung using that BAL technique. And then half of the horses, 10 of them, went on and were eating another type of forage called haylage. It's essentially a conserved forage. It's a bit closer in composition to grass compared to hay, so it's not as dry. And then the other 10 horses were switched over to pelleted hay. And what she found is that if you measure dust, sure enough, horses eating round bale are exposed to about 10-fold higher dust level versus horses eating pellet and haylage have really low dust exposure, but it's not different between the two. Then what about the cells? When she looked at the neutrophils, indeed they were high. Normally it should be less than 5%. So when they are eating, a round bale, even though these horses are completely healthy, they have inflammation in their airways. And then it dropped in both of them because they're exposed to lower dust level. But you can see it plateaued in the pellets versus on the haylage group, it went all the way down within normal. And that was after only 6 weeks on that forage. So something is happening here, even though they're exposed to the same reduction in dust, there's something else that benefits horses eating haylage. We'll talk about it in a minute. So that really led us to do other studies now going from the lab, the farm here on campus, to the real world at the racetrack. This was at our thoroughbred racetrack in Shelbyville, studying thoroughbred racehorses. And we decided to test different forages. Again, one of them was regular hay. The other one was the haylage I was telling you about in those sealed plastic bales. And then some of the hay, we can stick it in that big black suitcase to steam the hay. So essentially it sterilizes the hay after an hour or so it's cooked, and that's also generate less dust. So horses were monitored, with this dust sampling equipment I showed you, and we're also doing BAL sampling of the lung mucus in these horses at baseline, and then after 3 and 6 weeks on the different feed. What we found is that indeed dust exposure was reduced in steam hay and haylage. Here in the real life situation, the reduction was only 30%. So not that impressive compared to the round bale versus, pellets or haylage. But it was reduced. And also we found again that relationship between exposure to those fine particles, respirable dust, and inflammation in the airways. So as exposure to respirable dust increased, neutrophils in the airway increase. So again, that repeated some of our earlier findings. But importantly, there was a difference due to the forage. So here, the normal again for neutrophils in the airways should be around 5%. They all started there at baseline, but then you see horses on hay, they had a tendency to creep up as far as their neutrophils. The other two groups on lower dust forages tended to go down, but only horses on haylage decreased all the way down to normal and was statistically significant, compared to both baseline and compared to hay after 6 weeks. So what is happening there? And we had a hunch that it had to do with the fatty acid content of these products like haylage. And so we measured fatty acid in Jay Burgess' lab in nutrition science. And we found that indeed, if you measure one of the omega-3 fatty acid in the body called EPA, it didn't change with horses eating hay, even the steam hay, but it went up in horses eating haylage. And I'll show you some evidence why that might be, that it's beneficial to your horse's airways. So that led us to a bigger study. We wanted to essentially extend our findings here at the local track in Indiana and go and recruit other horses at different racetracks around the country. And we had a total of 4 racetracks now, one in Florida, Gulfstream Park, one in New Mexico, Ruidoso Downs, and one in California, Santa Anita Park, and then us here in Indiana in Shelbyville. And those horses were recruited to enter the study. The goal was at least 20 horses per track, and then they would be randomly assigned to their normal diet. So this time we wouldn't change the diet, we would just add a supplement of oil, either fish oil or corn oil. Actually, none of the vets or the trainers knew which supplement their horses were getting at. They had labeled A and B for the packs, and the oils couldn't be distinguished just by smelling them or testing them. And these horses were tested at baseline and then a month later. What we found was essentially pretty remarkable. Horses on the corn oil didn't change. Their neutrophils stayed the same throughout that month period, but you can see the one on the fish oil, there was a dramatic reduction in their neutrophils. So really an anti-inflammatory effect in those horses. And sure enough, when we measured lipids in the blood, we found that horses on the fish oil supplement had an increased omega-3 to omega-6 ratio because fish oil is rich in omega-3 fatty acids, whereas the horses on the corn oil had a decreased ratio because corn oil is basically omega-6 fatty acids. And then we were interested in modeling the interaction between really the fatty acids and the inflammation in the lungs, adjusting for dust exposure because dust exposure would be different between the different tracks. But because we didn't change that over the course of the month, we did that. And what we found is as the concentration of omega-6 arachidonic acid in the blood increased, so did the inflammation in the lungs. As you can see here, the neutrophils went up. However, when we looked at the concentration of omega-3 DHA as it increased, actually dampens the neutrophilic response in the airways. So it had a protective effect in those horses on the fish oil. So why is that? What is the deal between omega-6, omega-3 fatty acids? So essentially mammals cannot synthesize so-called essential fatty acids. There are 2 essential fatty acids that us and horses and all mammals need to get from their diet. The lead essential fatty acid, omega-6 fatty acid, is linoleic acid and ALA. And that acid, when it's coming typically from grains, so it's very rich in obviously a horse's diet or hay, then it's metabolized into arachidonic acid that leads to synthesis of pro-inflammatory mediators. Those are really key mediators when the body wants to fight against bacterial infection and parasites and so forth. On the other hand, the other essential fatty acid that mammals need is ALA, or alpha-linolenic acid. And this is metabolized into EPA and DHA, which are 2 other important omega-3 fatty acids. And those lead to the synthesis of so-called specialized pro-resolving lipids. And so you can see there's that balance between a pro-inflammatory side and anti-inflammatory sides. And as you notice here, all these enzymes are shared by the 2 pathways. So there's competition between the 2 pathways. If you have a diet very rich in omega-6, so a lot of grain, a lot of hay, then that will favor that arm and you'll have more of a pro-inflammatory bias. On the other hand, if you have a diet that supplies more omega-3s, such as fish oil or grass here or green leaves, then you'll favor more the anti-inflammatory pathway. And this was really a theory proposed and elucidated by Charles Serran from Harvard Med School. And essentially he showed using both rodent models and in vitro studies that those SPMs, those pro-resolving lipids, can really hasten recovery from inflammation. In the old days, I guess, prior to these studies, we thought that resolution of inflammation was essentially dilution of these inflammatory mediator once the infection was taken care of. So a little bit like the solution to pollution is dilution. While now the thought is, it's not that. We have actually, the body has pro-resolving mediators that are lipids that help speed up recovery. And his lab was essential in clarifying the pathways and the molecules involved. And we know from EPA we have several different E-series resolvins that play a key role, D-series resolving coming from DHA and myrcins, and protectins as well from DHA. And all this work has been done mainly clarifying the structure of those compounds using mass spectrometry. And this is a finicky technique, as you know, and a lot of researchers were having trouble replicating those results. And to the point that a couple years ago, there was an op-ed in Science saying, well, it seems that only Dr. Serran can identify those compounds using mass spec, because we certainly can. And in mass spectrometry, you like to see nice peak over the background noise, and a lot of those compounds are in such small quantities that they tended to hover in that noise region of the signal in mass spec. So we reach out to our colleagues across campus in the metabolics lab in Bindley, and Christina Ferreira and Amber Janash, to say, can we try to detect those compounds with mass spectrometry in your lab, because they were expert in that. And we wanted to compare that to a more classic way to try to detect those SPMs using ELISA test, basic ELISA test. And we could find 4 of those that we could use. So we submitted their samples, our samples from our horses from the HLH study. And sure enough, they could identify all the upstream lipids except the SPMs. They were below the detection levels. So we couldn't detect those resolvins, myrcins, and so forth. ELISA, we were able to identify those 4 compounds that we are looking for, and there's only one that seemed to vary based on the exposure level of the horses, and this was resolvin D2. And what we found is that when resolvin D2, so we modeled the interaction between airway inflammation, dust exposure, and resolvins. And what we found is when resolvin D2 was at low concentration, we had the classic schematic that I showed you, is that as exposure to dust increased, then inflammation, neutrophilic inflammation increased in the airway. But what we found is when resolvin D2 was in high concentration in the body, then you had a dampen effect on airway inflammation, essentially a protective effect of resolvin D2, which was very exciting. So these haven't been published yet. We are working on that. So I wanted to close with some of the latest innovation we are working on currently. So since dust is such an important driver of airway inflammation, the logical next step is how can we reduce, in the first place, exposure to dust? Why not developing a dust mask for horses? We use it for us all the time. Well, obviously, horses are exposed to dust when they eat, so you will have to have a mask that allow them to go about their life and eat and drink, but still filter the dust they breathe in. Well, the nice thing about horses is they are obligatory nose breathers. They cannot breathe through the mouth. So essentially, if you block off only the nostrils, then you can filter the air, and then they can eat and drink. So we work with, again, Jeong Park in Health and Science and his PhD student, Cheng Li, to develop this 3D printed mask. And we have a pilot mask. We just got provisional patents, so I can display to you what it looks like. And this is the horse, equipped with the mask. And we have sensors here that measure dust exposure outside the mask, inside the mask, so we can look at the efficiency. And it's connected to a mini computer that's worn by the horse, so we can see in real time what is happening as the horse is in the stall and eating. And another illustration of what some of the work we have been doing is a collaboration with Qingwen Lin, ME and BME. His lab really has the expertise in developing sensors, wearable sensor. You can actually print on fabric, stretchable fabrics. Say, why not doing it on a horse? And so that's what their lab did, and we tested it, and indeed we can record vitals in the horse, ECG, electromyographic activity, EMG, and also breathing activity. And this is one of the press release we had from Purdue Press at the time. And then there are many other direction that we'd like to take our research towards. So certainly we have a lot of work to do on that dust mask to test it. We certainly are interested in testing really the effect of those omega-3s on sports horses. They are very different from race horses in terms of their environment, their diet, so a lot of things that we need to learn there. Again, understanding more the pro-resolving lipids that are tricky to quantify is an interest of us. Also using machine learning to recognize BL cells. We spend hours looking at those BL cytologies, so we are doing some interesting work right now. Wearable sensors, we want to apply them to early detection of asthma in horses. So we could, say, oh, here we are getting into trouble. We need to do something before they get to the point where they have difficulty breathing. And then obviously we'd like to translate some of those findings for the treatment of asthma in people. And the last thing that I would like to mention is, all this work wouldn't have been possible if not for the amazing campus we have. We have a tremendous depth of knowledge, expertise. You could tell, hopefully, with this presentation that I collaborated with many, engineers, and so a tremendous, support here from that standpoint and expertise. And also, I had tremendous support from the vet school, and also from the state of Indiana, because we have funding. The Equine Sports Medicine Center receives funding yearly from the racing industry to help support research in equine health. So that's been essential. And finally, this work wouldn't be possible without, great students, vet students, residents, grad students, and also trainers and horse owners that were involved in many of those studies, and veterinarians in the field. So with that, thank you for your attention.
Thank you all for a fascinating talk. There's some time for questions, please.
Sure, be happy to take any questions. Yes, in the back.
With the omega-3s, was that something that is novel, or did that exist already in human studies? I mean, was there some reason for
Yes,
that?
the reason for the omega-3s, it's not that novel. The first study started with ethnologists that were visiting Inuit people in Greenland and so forth. And what they noticed is we are making a whole deal about fat in the diet here in our Western diet causing cardiac disease, and strokes and so forth. But then they were observing that these people were eating pure fat from seal blubber and seals, etc. And they had the lowest rate of cardiac events, cardiac infarction, and so forth than anybody. So the thought was, what is different about that fat versus our fat from, beef and so forth? Well, it's the composition. Seal will eat fish, which are rich in omega-3s. And if they started studying the omega-3, omega-6 ratio. So there was definitely an evidence that, inflammation was dampened because of that diet. And then there was some circumstantial evidence that the same process would happen for other type of inflammation in different body organs, including the lung. I must say the research in human lung disease is certainly behind compared to cardiology research. And right now there's, for example, no real clinical trial on the effect of omega-3 supplementation in asthmatic people, especially in children. With just a recent study in obese asthmatic, but it's a whole different phenotype. And so a lot of the studies are more questionnaire about your diet and comparing Mediterranean diet versus other, but this is more circumstantial and not really the evidence that you would get from a clinical trial. So that's where we're coming from. And the reality is that a few years back, and I didn't talk about this, I did a study in severe asthmatic horses supplementing with omega-3s because a company approached me to test their product, and they had some good pilot data. So I said, okay, I'm going to do it, but we're going to do a solid, clinical trial. And we changed the diet of those horses, put them on low-dose diet, and they either get that omega-3 supplement or placebo. And it worked beautifully. The old horses improved, which was the goal of the study, but the one on the supplement resolved much faster. So that started me thinking about it, and how can we apply it for other milder form of asthma. Yes, you had a question.
Thank you, that was really inspiring. You mentioned that both mold and dust are associated with equine asthma. So in your studies where you're looking at the effect of dust, are you able to measure and quantify mold control?
Yeah, good question. You are paying attention. So the question had to do with exposure to mold versus dust, which one is really... So it's much easier to measure dust in general, because dust is a general term that describes, mold, insect part, plant parts, a lot of different things that float in the air. To measure mold, you actually have to specifically look for those, and ways we've done that in the past to actually capture the dust on the filter, and then you grow it on a medium that will grow fungi. So I had a grad student do that and shown that you can culture over 20 different species of fungi by using that technique. And actually, we use also a DNA extraction technique to try to confirm that indeed these were the species. And we identify 33 different species of fungi. So it requires a lot more digging to measure that, but it's possible. The bottom line is, it seems that what's more important is to measure really, quantifying the dust is quite important. Certainly you can dive deeper and you can, dissect what is in the dust that's causing X and Y. We actually have a funded project right now where we have samples that coming from practitioners all around the country that send us long fluid sample, the BAL sample. We just got funding to do just that, extract DNA from those fungi samples. So that's Becky Wilkes at ADDL doing that. And we're going to see, okay, what are the fungal organisms that are present in those samples? And especially geographically, do we see differences? Because when we looked at the type of cytology or inflammation from those horses from different regions, we see different phenotypes, California versus Texas versus us in the Midwest. So it would be interesting to know if it's due to, obviously it would make sense that you have different fauna. So we're comparing those so-called ecoregion right now for the different type of fungi we can extract from those samples. Yeah. Yes?
Just briefly, I don't know if you touched on it very much, but another variable here is the breed of horse. You talk about horses. Is that who's playing?
Yeah, so the question is, does the breed of horses, play a role? So in a lot of the studies in racehorses, these been in thoroughbred racehorses. They are very closely related from a genetic standpoint. So that allows us really to focus on other factors. We know that for severe asthma in horses, there are some genetic factors that play a role. So there are some well-known families of lipizaners, for example, that are highly predisposed. So if you have a stallion that's affected by severe asthma, we know the offspring are 3.5 times higher risk of developing asthma. If both the mare and the stallions have asthma, they have 7-fold increase in risk of developing severe asthma. So there are genetic factors, but when people compare different stallions that had asthma, there were differences as well. So different gene associations, and it's not obviously one gene, one disease in this case, like asthma in people, it's a multifactorial disease. Yeah. So to answer your question, we haven't looked at different breeds for the milder form of asthma. My sense is the environment overrides anything that's genetic background. That's the reality.
Well, maybe you will gets the last.
The last one, okay. Well, Ron, have you looked at the role of endotoxin?
Yes.
Because I know some of the initial studies that I'm familiar with.
Yes.
Looking at asthma in children.
Yeah.
That's been theorized as a big component.
Yes. So Dean Reed's question has to do with endotoxin content in the dust. And obviously dust is not a sterile environment as bacteria has endotoxin to it. And we know that endotoxin plays a synergistic role. So if you nebulize moles, you get a neutrophilic response. If you add endotoxin, you'll have an increased magnitude of the neutrophilic inflammation. And it's not just additive, it's synergistic. We indeed did that type of studies, so collecting dust and measuring endotoxin content within the dust. Some of the earlier graphs that I showed actually where the relationship is between respirable dust exposure and neutrophilic response is adjusting for the endotoxin content in the dust. And indeed, we see a greater magnitude in the increase in neutrophils when there's higher dust content, higher endotoxin content. And the relationship is actually more complex than that. Endotoxin is not just linear. Actually, it's a parabolic shape. At very low endotoxin concentration, there's actually also that synergistic effect. And then it's kind of dies down. And then as you increase again endotoxin exposure, it continues to rise. So it's a bit more complex of a relationship, but yes, it is an important factor as well. Yeah.
Any other
questions?
after Dean Reed? No, I want to thank the speaker again for the fascinating talk. Again, speaks volumes to the interdisciplinary nature of the research here, and then the beautiful combination of teaching, research, engagement in our college. Thank you so much.
Thank you.